Hello, Diana. How you doing? Hi, Diana. How you doing?
I'm good. Hi, how are you?
I'm good. I'm good.
Like this. Hi,
Hi. How you doing?
I'm good.
So I think we're still waiting for Elena, and we're also waiting for my colleague, supervisor, actually, Josephine. She should be joining shortly.
Yeah.
I just want to make sure what's going on.
I was just doing my mail in the meantime.
Alrighty. Hi, Joe. Joe, I have a quick question. Hold on. It says it's oh wait, she's coming back, I think.
I'm here.
Oh, so I never usually had it like this, but when I started it, it says it's recording already because I know it does that automatically. Where do you go to broadcast? Because I don't see the option here.
That's strange.
It is, right?
It's usually always at the top. So
Yeah, I might have to text Kelly because I cannot find it.
yeah.
Here, you know what? Let me make you host. Let me see if that changes anything. If not, sign it back to me and then we'll figure it out.
Okay.
Make host.
Did you go in? You went in from the.
I went in through the account. I went in with the Okta.
Right.
Are you seeing it or no?
I don't see it.
All right, let me contact her then.
Live on Facebook. Hello, Diana.
Hi.
I'm nice to meet you.
Nice to meet you too.
Thank you so much for doing this.
Yeah, sure. I've been doing it once, the Dutch session.
Yeah. Mm-hmm.
So now I'm going to co-host it with Elena.
Right. Mm-hmm.
Yeah.
That's great.
So, Diana, I think we can just do it the same as last time. I'm not sure if you're running the presentation off your computer or off Elena's, and then
I
you
guess
guys will
on
both.
Elena's.
Okay, so
Okay.
you'll share with, so you need to share screens with Elena when she gets on.
Okay.
It's like, can you see?
I had a quick run through with Elena yesterday.
Okay.
So I'll be doing my email in the meantime, waiting for Elena.
Okay. So it turns out, I think due to, I guess, some error on Zoom, we're technically live right now.
Oh,
Okay.
Yeah. Which is fine. It's fine. So I'm just going to share the presentation. I don't think it should be an issue because no one has joined yet. No
joined yet.
attendees. Yeah.
Mhm.
But just in case, just so that we're all aware that we are in fact live.
Okay. Well, let me see if there are questions that already came in.
Go ahead and share the. You guys all see that?
Yes.
Great.
Mm-hmm.
Great.
I feel like I'm dark for some reason, but. I don't know why it's different today than other days. Patient to patient. So I'm looking through the questions that were asked here. Many of them are looking for patient-to-patient support or mentorship, but they don't say where they're from. I know that we do have mentorship programs, and if somebody's a teenager and needs to speak to a teenager, we can set that up. There's one here about, we ask certain questions to find out where they are in their, medical journey so that we can set them up with somebody that's similar or that can help them or has been through it. So
Yeah.
I can, I will.
Wait a minute. We have someone in the attendee. Diana, do you know if this is Elena and the attendees? I'm not sure because it's.
Let me see.
Because I know last time she joined after she joined with a different name. Let me check my email.
Can you see the attendees?
Yeah, it says POTS and then.
Oh, it could be.
Yeah. Okay.
Yeah.
Wait, let me see.
Because she has pots.
Okay.
Could be her.
Yeah.
So I guess that is her.
I think I'm host, so I can do it.
She just WhatsApp me saying, yes, it's me.
Okay. Okay, great. Yeah, so Joe, if you can move her over, I don't think I have the ability.
Yeah, I see your picture now. Hi, Elena.
Hi, promote to panelist. Okay. Yep. And
she should be here now.
Hi, are you there, Elena?
Yeah, here she is. There we go.
Okay.
Hey.
Hello.
Once I'm in, I can change the name, but it's first when sometimes it shows up, and so sometimes I'm able to change it before entering.
Okay.
Oh yes, I mean mine says Zoom 1. Yes, I should rename mine as well.
There you go.
Perfect.
Yeah.
Bruno, how do I make you host again?
You go to attendees, and then you go to the little ellipses on the bottom right, and then you put
make host. Yes.
Oh yeah. Or you just go to my name, you make host. Yeah, I should be host now, right? There we go.
Okay.
Yeah, it says you are the host now. Great. Hello, Josephine. Nice to meet you.
Nice to meet you.
We do have one attendee so far in here. Hello, welcome. We will be starting in about 10 minutes. Let's see.
I was able to see you all and to hear you, but I wasn't able to speak.
Right.
So,
I guess it was a little bit like an error with the invite or whatever.
Yeah. Actually, it should be a waiting room where people are waiting until they come in.
Yes, there is. Well, yeah, I don't know how it's.
Okay.
So
Elena will be running the presentation off your computer, right? So
yeah.
when it's time, once we introduce you and say we're ready to go, I'll stop screen sharing, and then you can go ahead and take over. And then when you finish, I'll take over again, and then we'll do the Q&A portion.
Okay. And you have the updated slides, right, Bruno?
Yep. Yep.
I see. I'll close the door behind me. It looks better.
All right, I'm going to go ahead and mute my microphone so that my parrot doesn't scream.
You have a parrot?
Yeah, I do.
Cool.
And it's cool for like 10 minutes, and then you get used to it.
And Josephine, where are you based? Because I know where are the others based, but
I am also on Long Island in New York.
Ah, okay.
So I actually very close to the foundation's office.
Okay.
And I've been with the foundation for 20 years.
That's long.
Yeah.
Wow.
Do you have Marfan yourself?
No, no,
Family member?
no,
Not at all.
nope. I applied for a job and I got the job.
Wow. Good for you.
It was it was a long time ago when they were expanding the research program. So I'm the chief science officer.
Hmm.
So, and I was a researcher before in a lab, so.
Okay.
I'm just checking the questions which are already.
Yeah, I was telling Diana that yes, so I was looking at the questions as well. You know, we do have mentorship programs here with the foundation.
It really depends which country.
Which country? So I think I'm gonna ask people to put in where they're from as well,
Yeah.
so that we can determine what would be the appropriate thing.
Yeah, and they can feel free to write in Spanish, English, Dutch, German,
Okay.
and written Italian. I should be able to read it, but answer in English.
Okay.
Bruno or Joe, are you telling that this is going to be recorded and online, because there was already the question if
Yeah,
the
sure.
Spanish one was recorded, so.
Yeah, so all the ones that have already passed, we have recordings of all of them, and they'll be going up on the foundation's channel, and there'll be
Yeah.
information on that.
Yeah,
as
but
it comes up.
I just mean that you said that they are being recorded and being
Absolutely.
uploaded, because this question comes up
All
every
the
now
time.
and
Yeah.
Mhm.
Yeah, well, yeah, don't worry, we'll make that clear once we get started soon here. Another 5 minutes.
Hi, everybody. So if you are joining the meeting, you can put in your chat, in the chat box where you're from, so we can read those off.
so.
One is from Oxford, England, and
Yeah,
Dallas,
Dr. Noe.
Texas.
Yeah. And Mr. Baskarans from the United States. And also the bottom one, Zoe, is also from the United States.
I
Yeah.
see.
Oh, Saskatchewan, Canada.
Saskatchewan, yep, Saskatchewan, Canada. Mhm. Welcome, everybody. Very global community today, so that's great.
Yeah.
One's from Missouri.
Kansas City. And New York. Ah, that's Bruno. I first read where they come from, and then I'll write.
He'll be starting just in another few minutes.
I'm writing they can ask in the different languages, but that we will answer in English so it's understandable for everybody.
Mm-hmm. And we have 12 participants, and we'll be just starting in another minute or two. You can let us know where you're from in the chat box. I see somebody from Arizona. Welcome. From Maryland. I see we're up to 18 people so far. We'll be starting in another minute. Just want to make sure that everybody has a chance to get in. We have a very global community today, people from all over the world.
We have already one question, and it is, do I need to download the Huber app to watch the recordings?
Yes. All right, so let's get started. First, I'd just like to introduce myself. My name is Dr. Josephine Grima. I'm the Chief Science Officer for the Marfan Foundation. I also like to introduce you to my colleague, Bruna De Salva, who is going to be helping us here today. And I would like to welcome everybody to the third and final week of the International E3 Summit, Educating, Empowering, and Enriching Our Community, brought to you by the Marfan Foundation and its divisions, the Loeys-Dietz Syndrome Foundation and the VEDS Movement, and also our partners in Europe at VESCERN. We really want to thank you all for making this summit truly historic. It is by far the Foundation's largest event, with nearly 2,800 registrants from more than 72 countries. We hope that you have an opportunity to connect to people from all over the world in the app, and that you maintain these connections after the summit. As you surely know now, you are not alone in this journey. We are very grateful to our presenting sponsors, Brigham and Women's Hospital and American Communications Construction. So before we start the presentation, I just want you all to know that the International E3 Summit is a forum to provide an open discussion of issues related to genetic and aortic and vascular conditions. Opinions stated in each of the talks are those of the speakers and not necessarily those of the Marfan Foundation or VASCERN. If you have questions that arise or clarifications that are needed about the differences in opinions between session speakers, you can contact us on our website at marfan.org/E3ask. The volume is very high at this point, so we'll try to get back to you as soon as possible. So please be patient. We'd also appreciate if everybody after the session would take a moment to rate the session. You can do it right on your Hoover app where the arrow is pointing. It's just 3 questions. It will help us to determine better programming for the future. So, before we move on to the presentations, I'd actually like to introduce you to our speakers. We have Diana Maas and Elena de Moya Rubio here that are going to share their experiences with certain and their medical journey with this. And I hope you enjoy their presentations. This session will be recorded, so if you will find it on the Hoover app after probably 24 hours, it would be back on the Hoover app. And if you have any questions, please put them into the Q&A section of the app, and we will be trying to answer your questions. You can post them in different languages if you're from a different country and you prefer to write in a different language. We will try to get to your questions. So to start, I think we're going to have Elena start by sharing her screen.
Yes, I'm on my way. So that's it. So hello everybody, this is Elena de Moya, and I come from Spain, but I live in Germany. So as Joe already said, if you have any questions, feel free to type them in English, Spanish, German, Dutch, or Italian, as we understand them, but we will be answering in English as so everybody can understand them. The answers. And before I go with the presentation, I want to present also Diana Maas. She's also here today, and she's from the Netherlands, and she will take over a little bit later. Yep. But first of all, who are we? Why are we here as patients, and what is our experience? So you've seen I come back. You've seen that said EPAG co-chair and EPAG advocate. What's EPAG? EPAG are patients in the European reference networks, and these ones are 24 European reference networks in Europe. They were launched in March 17, and they aim to facilitate discussion on complex and rare diseases and conditions that require highly specialized treatment and concentrated knowledge and resources. This means we take knowledge to the patient, and the patient doesn't need to go to the knowledge. And what are rare or low prevalence complex diseases in Europe? It's 1 in 2,000. That means 30 million EU citizens. So when we say rare, it's like tiny, but when we are all together, we are a lot of people, so we have a lot of power. And BASCERN, this is the net where we are in. This is the European Reference Network on Rare Multisystemic Vascular Diseases. So if you want to learn more about it, a little bit more in detail, or a video, there is one video, how can BASCERN help you on YouTube? You can watch it afterwards. It's always available, and the slides will be also available, so you'll have all links together. And in this net, there are clinicians, and there is the European Patient Advocacy Group. That's us. So that's patient group, which is in every ERN, in every net, there is one group of patients. And we are patient advocates, that we are active, working with the clinicians. And this group was established by ERNS to optimize patient involvement in the ERN's decisions and activities. So they were not meant to be at the very beginning, but ERNS, which is the European Rare Diseases Association, fighted for it. So some ERNs, like Basque-Kern, have formally recognized us as a group as part of their governance structure. As you can see here, don't worry, that's a lot of information. Important is patients are in the middle, so we are everywhere. And you will say vascular diseases, that's a lot. Yes, we have 5 different groups depending on the diseases. So PPL is pediatric and primary lymphedema, vascular anomalies, medium-sized arteries. There is vascular EDS in there. And then we have HHT and HTAD, that's us with Marfan and LDS. So at the end, we patient advocates. So each and one of us represents the interests of the wider patient community, not just the Marfan or LDS. We are there for everybody. And then we represent also the specific rare disease. And we make sure that we are included in the delivery of the networks. So to say, we bring the patient perspective to the table. And our main goal is to raise awareness in the impact of living with a rare disease. So every time there is whatever an activity they are thinking of, our work is to say, do you remember patients? How would this feel for them? Is this good for them? And is this improving their quality of life, for example? So active, we are 4, and we are working together. You see me on the top as I'm a co-chair. This means I'm in other meetings with the clinicians and with other coordinator. It's more a coordinator than a chef. So then Francois from France, Diana Maas from the Netherlands here today with us, and Romain Alder. I'm sorry, Romain. He is from Belgium. I cannot pronounce his surname. For me, he is Romain. So what do we do at the very high level? We also try to build a larger network within the patient community. So the more we are, the stronger we are, the less work for every and each of one of us. And we also work for the integration of everything we do at the European level in our national healthcare systems. We have so many differences in the different countries that we know what we want to reach everywhere, and then we have to see how to implement that in the different countries. What we've done so far is we were involved in the development of a patient pathway. Already second version, we are in the development and translation of the Basque-Kern app. That means when you are traveling in Europe, you can take a look in the app and see where is your next Marfan specialized center, or HHD or Basque, or whatever vascular disease we represent in Basque-Kern. And we are also making pills of knowledge. These are usually short videos which are in YouTube, but we also do offer webinars with our clinicians. So that's some things. Other are the development of do's and don'ts. So we try to bring the patient's side into it, and you have made, maybe this is not so easy to understand, or another question is also important for patients. So, and this is going to be updated every few years, so, or so, and then we are in the transversal working groups. This is not just disease specific, but registries, for example, and then the thing that we learned there, we can apply for the disease. And we are in a lot of online meetings. It depends at what level you are, then you have more online meetings, and then you coordinate with your. So this means we are a very strong team, and in more than 2 years, we have a very strong relations and cooperation and friendship. And we are always participating in training offered by Eurodis to get the best of us to be able to deliver the best for everybody. And now I would like to give over to Diana.
Yes. I'd like to speak to you about the lifestyle modifications and the quality of life. I think most important of this slide is that you are foremost responsible for your health. Clinicians should inform you as complete as they should, as they can, so you as a patient can make a well-founded decision. And that means, for example, years ago, they would say that sport would be not the very best of decisions for you, but we learn nowadays that it's not that black and white. Maybe you should reduce your sport intensity when you get your diagnosis. And there's for instance, when you are riding horse, then maybe that's on a high level, at least, maybe that's not the best sport for you, maybe because of your lens, but you can do riding on a lower level to still strengthen your core, but the intensity is lower. And maybe you should consider changing your sporting type. For instance, maybe basketball is not the best for you because it's a contact sport and it's pressuring on your joints. So maybe you should consider changing your sport type. There is a movement called 3 a week, and you can find videos on that on YouTube. Correct me if I'm wrong, Elena. 3 a week, the importance of exercise in Marfan and HTAD. And the second one is from, is it?
Exactly.
Sorry?
The first one is in English, but has subtitles in many different languages. The second one is in French, but
Right.
also has subtitles. And the first is an interview, clinician-patient, and the
Yes.
second one is just a clinician.
Right. And then there's this Facebook group you can also watch and join.
Yeah, that's a Facebook group. That's not from Basquern directly, no. So it's not. So we started it, but it's not like a medical recommendation, because we are patients. We always can talk about our experience, and
Yes.
some people have found ways to do sport without harming their bodies, or they have talked with physiotherapists or some clinicians, so they have adapted some exercises and they post them. So it's, if you need some ideas what might be good, you can check and talk to your clinician and say, would this be good for me? And when you do that, then you can post. So everybody is given in more feedback and we get more ideas what to do, because the worst we can do is doing nothing.
Exactly. Exercising is important.
Yeah. So that's for that. And then job decision, Diana, yeah?
Yeah, job decisions. A lot of us are doing office or administration work, like myself, actually. I used to, not anymore, but I used to. But as an example, Elena wanted to be interpreter in Brussels in the European Union and the Parliament. And you can imagine the stress that would cause, because it's a very stressful job. And instead of that, she worked in the tourism sector, doing events and exhibitions where she can still use all of her talent in languages, but it wasn't as stressful as being the interpreter in Brussels. For myself, I'm a volunteer, and that gives me the flexibility to work under less stress from a boss saying at 9 you have to get in at 9 and then work a whole day, and at 5, and then maybe afterwards go exercising or whatever and being totally exhausted. So that's why I eventually did volunteer work. And it's an environment where there's more understanding for your disorder, and maybe they're more flexible to if you're not feeling well or well enough. So it's easier, even with maybe with friends and family, society. You can choose your tasks, and it's more on your own terms. Also, volunteer work does come with obligations, of course. Every job does, even a volunteer job, but there's more flexibility. Then on free times, holidays and hobbies. Well, some of us like to have very active holidays, like walking, mountain hiking, but take your time, make pauses, because it's very, I wanted to say stressful, but it's not necessarily stressful. I'm looking for the good word. Maybe Elena, you can join in now. What I'm talking about. It's not really stressful, but it's
yeah, it's too much for your body. It's just actually it's not stress. It's
that's
just
what it
too
comes
much.
down to. Yes, that's what it comes down to. We give you some examples for G-forces, like parachuting, bungee jumping, a carnival, a roller coaster. And I've got an example of my own, an experience of my own, which I like to share with you. I went to a carnival, and there was this, maybe you know it, it's a ball on elastics, like an reversed bungee jump, and then the elastics are released, and then you jump up in this ball, and then, well, whatever, it was fun. But the fun lasted not that long, because afterwards, directly afterwards, nothing was going on. But a bit later, I went with my friend to get a drink, and we were at this bar, and maybe it was a span of half an hour or 45 minutes afterwards. And so I was having my drink, and suddenly I felt this very, very sharp pain in the back, in my back. And it got me unease. I was very uneasy, and I didn't know what was going on. So I went to the bathroom and back. I went outside and back, and outside again, standing up, sitting down. I didn't know what to do. And And then suddenly I got this awareness. Okay, where do I feel this sharp pain? And it was like on my heart, but on the other side. So I thought, this could be my aorta. I just had this, epiphany. And luckily, there was a friend of mine who knew me very well around. So I asked him to drive me to the hospital, and he did. And then I found out hours later that my arch was ruptured. So no carnival for me anymore after that. Yeah, we write these examples, but it's to taken very seriously, and especially when you are familiar with aortic diseases, then especially, and if you're not sure, ask your doctor and get advice. That's my advice to you.
Yeah, so always asking your clinician is really important. And what you it's like, even if you are not doing something, the G-force is acting on you. So this is what we try to explain to you, so that when you are doing a parachute or a bungee jumping, you are not doing really anything,
No,
but G-force is doing a lot for that.
I was just sitting down. So I wasn't doing anything. I was just sitting down.
Yeah, and carnival concerts and so on, you can go there, but take into account that it's like basketball, so you don't need to be in the middle of it. It's better to be at the side so you don't get bumped, or so it's quite better. So it's like in sport, not 100 and 0. Try to find your way to do things you like or adapt them. That's
exactly.
Yeah, and yeah, now remember to write your questions in the app, and we have left our emails in the greeting and in the presentation. You find them too. So if you have personal questions to ask, write us. If you have general questions, you have the link for mafan.org/ I think Joe.
We ask.
Yeah, I always turn them around. So maybe Joe can remember it at the end. But now we can also answer questions to our own experience. So Diana, you.
Yeah, I just told you that back in 2005 it was when my arch ruptured. Years later in 2016, because back then there was no surgery. I just had to be flat on my back for 2 weeks and get serious medication, and then it healed itself. But in 2016, I had a rupture again on the same spot, and then I needed surgery after all. So, in 2014, I had this root replacement. And I have to say, all of my surgeries were not standard. I had a friend of mine without Marfan, he needed a root replacement as well, around the same time as I did, and he was working within 6 weeks. I was in the hospital for 5 weeks. So every surgery I had was non-textbook. So I'm quite exceptional with that, which makes it hard to be an example for others because it's not textbook. But why I'm sharing my story anyways is because I want to give you hope that even if it's not textbook, I'm still here. So don't assume the worst, stay positive. But I do want to tell you a bit about my surgery, like I like in the example, because I had aortic surgery in 2014, and that was when the root was replaced. That didn't go very well because one artery was replaced, so I had a bypass. But that bypass, that I don't know exactly the English word for it, but it got crooked. So I had an heart infarct. Do you know what I mean then with infarct, Elena?
Yeah.
Yeah.
So
Is that the right word for it?
I don't know exactly what you had.
I'm suddenly very uneasy about the word. Let me see.
Yeah, infarct is Schlaganfall or heart, similar to
Yeah,
heart attack.
infarction. Yeah, it's the right word. Luckily,
Okay.
infarction. Yeah. So they replaced it with a bypass, and that got infarcted. So then you think, okay, problem solved. Wrong. Within 24 hours, that bypass got clotted, so infarcted again. So for this one, they had an artery out of my leg, and then they had to use an artery out of my other leg for this infarction. So, like I said, non-textbook, and this took me quite a while to recover from. My heart really got got in bad weather, and that's when I needed ECMO. I have to tell you, all what I'm telling you now is from days after I woke up, because I had no recollection. I was just under anesthesia, so I didn't know all of this, but I was out for 5 days and under ECMO, and ECMO is a special life support system.
Yeah, we have heard that now with COVID sometimes, that some people need it also, but this shows also how important it is to make surgery, first of all, not as an emergency, but to have your checkups so that you can go to a specialized center. So in the Netherlands, it's a small country with a lot of centers. That's great.
5. We've got 5.
But it's better once you are diagnosed, please go to the checkups, to your specialist, so they can plan a surgery and then do it in a specialized center. So
always better than when you have to rush to the hospital, and a planned surgery is always better than they.
Yeah, and they are used to these surprises.
Exactly. Yeah, and then they and you can prepare for surgery.
Yeah.
So luckily I survived. My heart pulled through, and then I have to be in the hospital for 4 or 4.5 weeks, almost 5. And then I got released on Valentine's Day. How good is that, right? The day of the heart, and then I got released. So that was very, that was a very lucky day for me back then. So I can tell you a lot more about aortic surgery, but this was my most heavy one, I guess. Yeah. Another thing I experienced because of Marfan syndrome is cerebral spinal fluid leak. And it was a spontaneous one. It was back in 2016. And when I tilted my head, my heavy headaches were almost gone. But then when I came back up again, it was like very heavy. And I walked around with that for a few days, and, you know, taking your paracetamols in the morning, and taking a nap during the day. And then it would be less, and then it would come back again. And that took me a few days, and I thought, oh, this is not good. I need to see a practical general practitioner. So eventually I did, and she was very perceptive. And she immediately called the hospital neurology saying, I've got this lady in my practice and maybe you should see her. So I did. I went and I stayed for a weekend. First they wanted to treat me just by laying in the bed and then tilted back a bit, trying to heal itself, but it didn't. So on Monday, I got a blood patch and that worked perfectly. Within a few hours, I was my happy self again. So yeah, I could add some more experience on my Marfan list. Yeah, and yeah, we've got Elena and I do have something in common, but we get there later. First, I will let you listen to what Elena experienced so far.
Yes. One thing about CSF leak, remember that's a kind of headache which disappears when you lay down. So it's you sit or stand up and it comes,
Yeah.
and you lay down and it disappears. It can be as if it's a leak. Usually doctors think about that if you had some spinal anesthesia before epidural. But in Marfan, Lois did some vascular area. So in our connective tissue disorders, it could be spontaneous. So our dura, the skin is too thin, like our vessels, so it can have leaks. Just for you to know. And before I go a little bit in depth in the 4 things that I've listed here with inguinal hernia, POTS dysautonomia, cervical instability, occipital neuralgia, and Tarlov cyst, I go to the questions, and I can. So all of you looking for support, it's important that you tell us in which country you are. Otherwise, we cannot help you. But there are a lot in the US, in Latin America, and Europe, nearly everywhere. So let us know where you are, then we can tell you where to go. If it's US, marfan.org, contact them. For South Middle and South America, take a look at Connectiva. This is the new joint associations organization. For Europe, you can take a look at Baskern or MEN, which is the Marfan Europe network. So, or write us an email. We can tell you where is your next or closest group. For those looking for neonatal, please write me an email. There is a big international neonatal group. The meeting should have been yesterday if it's not postponed, but there is a group. So we can send you the contact. I see cervical instability, Tarlov cyst. I will talk about it in a second. And there was one US question, which was medical care without a full time. I know in the US this is really difficult. Please contact the Marfan Foundation for that. In Europe, we have medical insurance without working too. So I think it's in every country. So that's one thing that is a little bit more difficult in the US. And I think I went through most of the questions. If you have questions, please type in them in the app, so we can take a look to them. And if there is a question which is already there and we haven't answered it, please tick on the thumbs up, so this question gets about and we will answer it next. So then I go for the as it was a question, cervical instability and Tarlov cysts. Cervical instability, as the vessels, as the muscles, my 2 tendons, and which are in charge of the correct movement of C1 and C2 are too long. It's like they just got too long, so the cervical they are not rotating as they should. What could be a sign for that? Lots of headaches, lots, and watch yourself. Are you always holding your head with your hands or trying to put your head at the wall to keep it? Or when you drive car, or as a driver, or sitting on the other side, do headaches get worse? Do you get nausea? These are some symptoms that could be a sign for that. And it was not seen in a normal MRI. I needed an upright MRI where they were able, a functional upright MRI, where they were able to measure these tendons in different positions. So in a laying down MRI, it was not possible to see that. If you have more questions about that, I can send you lots of information, and also websites in English. And there in the US, you have a great specialist for that. In Europe, it's really difficult. So we even have problems for people who already have neurological problems. So my arms, for example, slip or get numb in the night. So now I get my collar at night, or in the car. At the very beginning, I had it 24 hours and took it just off to make my strength exercises, which my physiotherapist told me. So it's really, really important. If you get a collar, then please don't forget to do your exercises 3 times a day, every day. So once you are able to hold, like I'm holding now, for longer periods of time without headache. It's not necessary that the nerves are involved, so the roots, but it is enough to how is it? To make our nerves angry, because they don't know what's happening. Our nerves perceive too much movement in our necks, but it's like in a boat. We see nothing is moving. It's the other way around. Our eyes see nothing is moving, and our nerves are getting the information everything is moving. So this is why also you get headaches. And one option also is that you get occipital neuralgia, also known as Arnold neuralgia, which is the occipital nerves which get inflamed, and it goes up, it goes to the side, on the eyes and the eyebrows. So this is a little slightly different from trigeminous neuralgia, which is another nerve in the head. But they are sometimes even mistaken or not really good known. So that's, or even also I have 5 or 6 different types of headaches. The other one is from POTS, postural tachycardia syndrome. When I get up, my blood, I have blood pooling in the legs, so I don't have enough blood in my head, in my lungs, and muscles in the neck. So I get this, what is called coat hanger ache, because there is not enough circulation. So everything goes like together, and the nerves are always are also irritated. So there are a lot of different headaches types that you can have, and to distinguish which ones comes from what. So but I keep my migraines good. So I haven't had a migraine for a long time, and all the other headaches, I know what to do when they come, or what to do to avoid that they come. Sometimes I don't want to avoid something, so I do it, but I know next day would be a headache day. But I plan that in my life. And title of cyst, some doctors call it dural ectasia, and other title of cyst. Sometimes it just depends on the size. When the dura goes wider and wider, sometimes you get cyst, and these ones are normally no problem. So it's just a sign which is which was in the nosology for Marfan, but most of us have them, and normally they give no problems, but normally. And you know, every Marfan person has its own Marfan, so normally it's not like we are zebras. We are not. We are colibris, like my lung doctor called us. So we are colibris. Every one of us is different. So there is a possibility that the title of cysts reach a root of a nerve. So you have neurologic problems, mostly in the legs, or lumbar ache, so back ache. That's one part of it. Even you also can have a lumbar ache without having a root involved. I don't know exactly, but I guess it is the same problem as in the neck, that there's too much going on in there, and the nerves are just that we are struggling with them. And the other thing that you have to take care of is when you do your checkup, please ask them when they do an MRI. First of all, every time you make an MRI of a part of your body, it should be the same place as the last time you made this part of this body. So if that's important for the way people or technicians measure. So it's always the same person measuring and the same machines. So you have this, so to say, a standard. And please ask them when you do an MRI of your back that they measure, they look up, that they should look up if you have a dura, if you have title of cyst, and if yes, please measure them. So then you can, it depends on the size and how it looks like. Even if you don't have any symptom, that's really important. So you know your basis, and then you can talk with your doctor if it's necessary to do an MRI in 1, 2, 3 years to look up how it evolves. Because the second problem is that title of cyst can, I say, they eat my bones. So once they get bigger and bigger, bone can disappear. So your spine can get a problem. So it is important to check, even if you have no symptoms, just check if you have a duress, as if you have toddler cyst, and if yes, measure them. And then decide if you don't have any symptoms, maybe it's enough in 2 years, but please measure them again so you can see how it evolves. It's like the aorta. It might be slowly, or it could be more quickly. So you have time to search a neurosurgeon which is experienced in difficult things and wants to make the surgery. That's sometimes the most difficult part. So, but that you are prepared and you know where is the professional that should do that when it's time, if it is time somewhere, somewhen. These things that are in the most common one in inguinal hernia, it's mostly when we are kids, we jump and run and then it happens. The other things, they are coming more and more, and we hear it more and more as we get older. Aorta surgery is getting better, so we get older, and then we get all that things that were also in the other EDS disorders. So they might help you. If you find no one specialized in the Marfan community, take a look at the EDS community, because they are used to these things. This was the things that they were researching for a long time. So, and now, Diana, do you want to say what we have in common?
Well, what we have in common is the cataracts and the part where we don't have children because of Marfan syndrome. In my case, it was advised against having children, not only because I could die because of many aortic surgeries already in my abdomen, but they also said how you can give it to your children and all consequences there. So yeah, the reason why I don't have children is because they advised against it for my own sake. How is that with you, Elena?
In my case, it's two sides. First of all, I was told it's a huge risk for me, even if I hadn't had an aorta surgery by now. And my diameter is like pretty small until, yeah, it's still, it was, I think it's 3 years ago, it was the first time that it was normal. Before it was smaller than normal. But my father, even with checkups, he had a spontaneous aneurysm. So he was doing his yearly checkups, and it happened. Yeah. In any case, so so I decided for myself, but also I was a child of someone with Marfan, and I had to take care of this person. So I thought, I don't want to give a child the same childhood and teenage I had. So I don't want to have a child and be egoist, and knowing that he or she might need to take care of myself. So it was not, and yeah, so that was both sides. My side is a risk, and his or her side is not he or her getting Marfan, because these days you can do pre-implantation tests, so it's not that. But being a child of a ill person is also hard, no? And you don't know. I don't know how many weeks or months you were in the hospital, but my father was months in coma, and afterwards he was in a wheelchair, and I had to take care of him because my mom was working in the for lunch and after school. So I don't want that for my child. You don't know even at what age it would happen. So you don't know if it's a 1-year-old, 3-year-old, 5 or 14. It doesn't matter. I was 14, so I was already grown up, and I had to take care. So I don't want that, and that was my reason. So it's not just you passing it, giving it to someone else, but also what life. So I see there is one question about school curriculum. It depends on the country. There can be accommodations in schools for children. And it depends, as I said before, each and one of us has a different marathon. This means that it could be stressful for a kid, but not for another one. It depends on how many symptoms and so on. So I studied a master's in a foreign country. So I've been traveling, and so it really depends on the kid. Less marathon than the kid. If he has problems with holding a pen, then there are things to hold pens. Maybe nowadays he's able to type in a computer instead of writing down things with pencils. So we didn't have that those days. But so there is, and for example, maybe one you can get a better chair or a higher table.
Yeah,
I remember my heartache at the back in the school, and I never thought of it being the chair. I thought it was my back. So it's funny because these are things you don't think when you are a kid, and you remind that later. And there, I don't know in the US, but in Germany, I'm sure. I don't know in the Netherlands, you can get also accommodations from your company for your employer. So you get higher tables and things. So
yeah, in the Netherlands too, also for schools, but also for jobs. So even your employer can ask for adjustments of the workplace, but that's also for school children. Yeah.
So so it depends on the country, but this is possible. And I've realized we are pretty we are motivated, so we are also wanting to learn. So don't let symptoms stop you. So I'm taking a look to the questions again. So teens and youngs, it depends on the country, insurance, mentorship in the US. And looking, so we have all questions through. So we have 3 minutes. So that means we have one thing left for you, which is the patient journey. As you've seen, Diana and I, we are patients. We are patients. No, we are not. So we are on a similar journey. We have things in common and other that are not yet. She knew her diagnosis after surgery. and I knew it when my father and my aunt and my uncle had surgery, and a doctor said, it seems to be in the family. So I was a teen. And so it's similar journey, but also different. But there is a point where you get the diagnosis. And from there, we have a similar journey. And as patient advocates, we try to develop a patient journey. So to sum up everything and to try, so in the different phases, pre-diagnosis, symptom diagnosis, treatment, surgery, follow-up care, what happens and what are your needs? And that's the most important part. Which are your needs? What should you get? What should happen? So this is, we are mapping your needs, and then we see where are the gaps in the clinical or patient pathways.
Right.
So that we work together with the clinicians to build better pathways, patient pathways, clinical pathways. So your needs are
Met.
fulfilled at all stages. So if you want to cooperate with us or be part of the project, we need people who talk to us about their journey. We need to make some steps yet, but if you send us an email, we have you in the contact list, and then when we start, we will contact you to do the surveys. And remember, we are on Twitter, Facebook, YouTube, and LinkedIn, and this is the website. You can find us also there. So
That's it, basically.
I think so. Joe, do you see any question which we don't see or we haven't
No, I think
answered?
you guys did a great job. You know, I would just like also to add the resources from the Marfan Foundation. You know, we do have mentorship programs on our website. I put the link I answered it with the link to many of the patients. We have a social worker on site as well. So for the parent with the losing a child at 3 months of age, just for coping, if you want to speak one-on-one with a social worker, we can make that happen. Her name is Susan Leshin. You can find her on our website. I can also put that into the chat. We have many resources for doctors. So for the person who asked about providing guidance for physicians, we have a healthcare section on our website, healthcare provider section, and that material is prepared for physicians that are not very knowledgeable in Marfan or in some of these others. So it's a good resource as well. So I want to thank you all, both so much for providing your insight, providing the resources, the global resources that are available, because we are a global community and we need to work together to help all of these patients.
Yep.
And so again, if you have further questions, you know, you can ask them at marfan.org/E3ask. This will be recorded, so you will also see all the links that our presenters have given you as well, and they put in their contact information. We would like that everybody complete the session survey, as I showed you before, right on the Hoover app where it says rate. You can visit our exhibitors in the exhibit hall. You can also connect with community right on the app. We have many different groups that are on the app. So feel free to, you know, reach out to people and talk to people. Everybody is willing to share their journey.
Joe, one question. How long is going to be available, everything in the app?
Everything should be in the app. We're thinking that it may be there till the end of the year at this point. So that we want it to be a great resource for people. So I think at this point, that's what we were thinking. So
that's great to know how long people have time to see the recordings.
To see the recordings, because there's a lot of information in there and a lot of recordings. So it would be, I think it's helpful for that.
And any idea on afterwards? Is there any videos available maybe on your website of this E3 Summit, or are you still thinking about how to?
Yes, so we do have a normal program. It's called our Victory Medical Symposiums, and we have different webinars, medical webinars done by our professional advisory board once a month on different topics. So they are listed on our website. We also have different topics that are for support. So quality of life sessions, you know, how to deal with pain, or how to deal, you know, cope with, you know, having a diagnosis. So all of those are also listed on our website. We do them through the winter months. So, you know, beginning in October, November, we'll start having one a month on our website. So you can take a look at those as well. And all the ones that have been recorded to date are there available free of charge, just to look at.
So before we go, thank you very much for giving us this opportunity. It was a pleasure to cooperate with the Marfan Foundation, and we hope that we do more together in the future with Bascurn. So as you said, the more we are, the more networks, the best for all of us. And it's great. Your website is a huge, it's a Marfan Wikipedia. So it's huge, and it's a great database. And if you are searching for something in your own language and it's not there, then ask the associations. I think we are all translating everything in all directions. So it's not doing something new. It's just a translation or maybe update. So thank you, Yo.
I thank you very much. We really do appreciate your help. One other thing, go back one slide. Yes, thanks. So we just want to let everybody know that September 19th through the 26th is Aortic Disease Awareness Week. And it's being powered now by the Marfan Foundation. And we would really love everybody to join our efforts to increase awareness about aortic disease by raising your hands and, you know, taking pictures. Information is available on the Summit website, on marfan.org. And this again is a global effort, and it's our way to be able to provide information to physicians, to patients, and everybody to bring awareness to this rare group of diseases. So we ask everybody to join in that effort, and we're looking forward to that. And that's it for today. Thank you so much for your help, for the people that have been participating. I think we've had almost up to 30 people participating today. Thank you very much.
You're very welcome.
Take care, everybody.
Bye bye.